I'm excited to talk to you today about the new way that respiratory therapists and nurses that draw ABGs and send the specimen to lab will document arterial blood gas draws in Epic. Areas that use point of care will continue the process they are currently using. Imagine this. You are taking care of a patient that is having acute dyspnea. You receive an order to draw an arterial blood gas. You're prompt at drawing the specimen, and now you need to send it to the lab for results. But what information does lab need before resulting in Epic? Everyone that currently draw ABG specimens are familiar with the paper requisition used with written documentation for information like location of ABG stick, oxygen delivery method, or even ventilator settings. These paper slips will still be used for downtime and for patient care areas that do ABGs using point of care. When specimens go to the lab, we have discovered that sometimes there is a delay with resulting ABGs due to inconsistencies in filling out this requisition. Therefore, the ABG specimens that will go to the lab are moving the paper requisition documentation into Epic. Starting on May 1st, you will no longer use the paper requisition slips unless we are in downtime. When an ABG is ordered in Epic, before sending the ABG specimen to the lab, this information must be documented in Epic, or the lab will not see the order and will not be able to run the specimen. Respiratory therapists will access the documentation differently than the ED nurses. I'll explain both. One way that respiratory therapists can access this is from their work list in Epic. When you click on Document, an additional screen will prompt you to fill in the multiple boxes. All the fields flagged with the red circle and exclamation point must have something documented. Another way that respiratory therapists can access this same screen is through the Summary Task Completion section. Locate your arterial blood gas and click on it. The same screen appears, and again, all the fields flagged with red circle and exclamation points must have something documented. The emergency department nurses will access the required documentation under the Specimen Collection task box in the ED narrator. When clicking on arterial blood gas, a window will pop up prompting you to fill out the box. I will show you some examples of charting in Epic. If the field does not apply to your patient's situation, then mark it with an NA. For example, if your patient is only on 5 liters nasal cannula and not on the ventilator, then mark fields pertaining to the ventilator with NA. Some of the fields have a lookup icon, which means that you will select an item from a drop-down list. This example is showing the options for device. Mode has a drop-down list that you will need to select an answer. Fraction of inspired oxygen also has a drop-down menu. You can select NA if this doesn't apply to your patient. Moving this documentation to Epic will help decrease mislabels, decrease patient resticks, and increase accuracy and speedy turnaround times. With a shorter turnaround time, it could improve patient outcomes. Please contact your manager or your clinical education specialist with any questions or concerns.